Currently admitted to your floor for 23-hour observation after a single vehicle MVC in which the patient was unbelted and hit the steering wheel at moderate speed. There were several fractured on ribs on the patient's right side, but no other injuries were noted. You're calling for discharge orders for the AM shift when the patient puts on their call light, complaining of severe shortness of breath. You assess the patient and note absent lung sounds on the right, anterior and posterior, as well as slight tracheal deviation to the left. Past medical history: diverticulosis times 4 years, occasional lower back pain with NSAIDs, tension headaches, pantoprazole, lactated ringer to keep vein open, and Percocet. So my next action would be to assess the patient's oxygen saturation and give them oxygen. I would also assess to see if the patient is, when they're breathing, is their chest moving similar on both sides bilaterally. And I want to know if this patient has maybe pneumothorax, or if the lung had, or if the ribs had punctured through to the cavity where the lungs sit in. Is there bleeding? Is there fluid? Did the lung collapse? So I would assess oxygen saturation and see what's going on. And that's my thoughts on what's happening. I think that maybe this patient has a pneumothorax. I think that what happened to get this patient to this point is from the trauma of the broken ribs. I think they punctured something to the lungs, and maybe there's fluid or something going into the cavity surrounding the lungs, and now it made them collapse. There's no negative pressure for the lungs to stay open. Are there labs or diagnostic tests? I would recommend a chest x-ray to view the lungs and see what's going on. Are there medications appropriate? Maybe I would add, this patient's taking pantoprazole, lactated ringer, and Percocet. Maybe I would add an antibiotic. Maybe a chest tube might be inserted. Let's see, and that's it.